you've got a skin lesion, it's better to get it seen by a person who's a specialist in assessing skin lesions and is capable of operating with a dermoscope. And good morning, everyone. Today we want to talk about skin lesions, which is one of the things that we do at JR Medical day in, day out. Basically, if you've got a skin lesion, it's better to get it seen by a person who's a specialist in assessing skin lesions and is capable of operating with a dermoscope and knows what they should be looking for. It is very easy to miss out skin lesions, as even in the eyes of the most expert dermatologists, a lot of times the skin lesions are diagnosed incorrectly. Hence the reason they're taken for biopsy and they're sent for pathology. Lots of times we come across patients who they put a diagnosis on their own skin lesions and they consider either to be a benign mole or a seborrheic keratosis or a skin tag or something they try to remove by their own self, and or they had been down to the pharmacy and they got a chemical from the pharmacist and they try to remove the skin lesion. We strongly advise against it, because obviously when you tamper with a skin lesion, as soon as we start to look at it with a dermoscope, the picture which we see is different. Okay, as you can see on the screen, there are sometimes skin lesions which are very clearly marked and the area around it is basically very clear. They don't have any different colors on it. We understand that there are signs for skin cancer which they are pointed out to the members of public, which those lesions are very easy to diagnose, but it's not always the case. That's the reason that we check every lesion under a dermoscope, even though it might be a skin tag or a seborrheic keratosis. What you do with us at JR Medical is that you book your initial consultation for the assessment. Then we have a look with the dermoscope. Normally two of our doctors, we look at the skin lesion. If it is something which can be done by our laser surgeon, if it is a benign lesion like a seborrheic keratosis, a skin tag, or something in the same line, a wart or something in the same line, we just do it in our theater by the laser surgeon. If it is something which has to be escalated to the basically dermatologist surgeon, then we escalate it. It doesn't matter what we see in the skin lesion, because that is not always the precise diagnosis, and a lot of times we require the pathology assessment. Sometimes even pathologists are not in the same opinion when you send a lesion to them. So basically sometimes not this two pathologists, they have the same opinion. And then they have to discuss between themselves to come to a conclusion. Please don't take skin lesions lightly. Please don't try to remove them by electrolysis or something, because we have seen too many times that the skin lesions have been misdiagnosed. Thank you for tuning in to JR Medical.